Hello folks, how are you doing? Don Kelly here. Happy Saturday to you all. Hope you're all keeping well with this coronavirus buzz going on. So look, just stay safe and stay in, okay, and do your social distancing and do what the politicians and what the health experts are telling us what to do, okay? So stick with that. All right, I tell you now why I'm here. We're going to talk about I'm going to give you some tips on how to manage pain in the balls of your feet. Okay, the medical name for it is metatarsalgia. So it is basically where on the ball of your foot you can present with pain, especially at weight bearing. So when you go for walks or anything like that, you're getting pain on the ball of the foot. So I'm going to give you some tips and some ways how you can self-treat it and how you can help look after it, okay? Because as it's on the foot, it can limit your daily living, by just going for walks and things like that, okay? So what is it? It's basically in between on the ball of your foot, it gets inflamed, it gets irritated, and it's basically like having a boil or a sore on your hand, and if every time you pressed it, it would be painful, okay? So this is similar to when you get pain in the ball of foot of this condition. Every time you walk and you push your foot off that way, you get pain, the minute it hits the ground, all right? So the pain is fairly severe. People end up limping and can't walk on it, and what can happen if it's ignored, if you don't do anything about it, you can start presenting with other problems, like knee pain, hip pain and back pain, because your whole gait and your whole balance is going to be affected over a period of time. So you can start developing these type of symptoms as well. So you got to be very careful. So ball of foot pain, when you get it, you should always get it checked out. And it can be treated, okay? So a few tips on how to manage it, okay? Stop wearing high heel shoes, okay? This is especially for the ladies and maybe some men out there too. But if you're wearing shoes with fairly high heels, you're going to put a lot of pressure on the ball of the foot, and over a period of time, that pressure, it's going to be like an overuse syndrome, and you're going to create stress on the joint in the metatarsal, generally in between the second and first second in that area, and you're going to create a lot of stress on that because your foot is going to be at that angle from wearing a high heel. If you imagine this is your foot, you wear a high heel, now your foot is like this, okay? Now when you walk, your toes are going to go up like that, so it's putting pressure on the ligaments, it's putting a strain on the ligaments in between the metatarsals, okay? And that strain, eventually the ligament will get inflamed and the joint will get inflamed, the structures within the joint will get inflamed, the synovial fluid can get little bursas, things like that, Morton's neuroma, which it becomes you start getting pins and needles and neurological sensations in the ball of foot there as well. So by wearing a high heel, so if we imagine this is the foot, here's the heel, now the foot is like that, so you're going to be on the ground, and it's non-natural, basically it's unnatural position for the foot to be putting pressure when it hits the ground. It's constantly being put under a strain, being put under a pressure there. So avoid high heels, high shoes, what you call them, stilettos or whatever. But anything like that is very, very bad. Very bad, okay? I recommend people nothing more. Your heel shouldn't be bigger than an inch, all right? Anything higher than that, you're putting pressure on the front of the foot, and it's not designed for that. And over a period of time, if you continue to wear that, you will get a lot of pain on the ball of the foot. And it can be fairly tricky to treat, especially if it's left prolonged for a long period of time, okay? So that's one reason, it's the most common possibly, okay? Other people who can get this, other reasons for it, is ill-fitting shoes. So if you're wearing a shoe that's tight, especially up by your toes, okay, you know, that is going to put pressure on the joints as well. Again, it will become inflamed over a period of time. So if you imagine, if I caught my hand and I just kept squeezing it, but we kept doing that for 8 hours a day, and you kept squeezing that hand, and you do that every day, okay, hand is like this. If you imagine that's the foot, you're wearing ill-fitting shoes, they're squeezed. It's unnatural, okay? You're going to create restriction in at the joints. Anywhere where there's going to be restriction, you're going to increase or decrease the blood flow in the region, okay? You're going to decrease natural movement within the region. And if all these are decreased, you will eventually the body will try to respond because it sees it as a trauma, and it will create an inflammatory response on the area. And again, this is another reason you could get pain in the ball of the foot, is for tight, ill-fitting shoes. Okay, so avoid those as well, okay? You should always have a nice little bit of room in your shoes, especially at the forefoot or up by the toes. You know, so any shoes that are very pointed at the top are really not good. Okay, not good for your feet. I know they might look good with your skinny jeans, but it's certainly not good for your feet. So be aware of that. Okay, another reason you can get pain in the ball of the foot is if you're doing excessive running or excessive jogging. And if your running style or your running gait isn't, if you're not running correctly, as it were, i.e. if you're just running on the ball of your foot and not heel striking and then coming heel to toe. All right, so a lot of runners can get this pain, and the possible cause of that is the running style might be off a little bit. There might be, or more than likely then that might be, they are running on the ball of the foot and they're not heel striking, so all the pressure is on the ball of the foot. Okay, so you need to change your running style if this is happening. Make sure you're heel striking and pushing off. Heel has to hit the ground. Very important. Okay, you'll see in sprinters who, you know, in the Olympics and athletic events like that, sprinters, you know, 100 meters, their heel doesn't touch the ground. You know, they're on the ball of the foot and they're running. But it's over a period of, depends how fast you are, but international level world athletes will run 9-10 seconds. Okay, their heel would not touch the ground. Okay, so possibly, and you'd imagine the runners, their shoes, they're really paired onto them, you know, so it's quite possible these guys over periods of training to get pain in the ball of the foot. But if you're a runner or a jogger, if you're the weekend warrior and you're getting pains in the ball of your feet, maybe you got to look at your running style, okay? You're quite possibly not heel striking, all right? And if you're not heel striking, you're just running on the ball of your foot, so it's a constant pressure. You'll see it as well with boxers and anyone, you know, doing skipping, things like that in training, you know, it's any repetitive movement that's on the ball of your foot. So if you're skipping, you're going to be on the ball of your foot. You see boxers, you know, any of those type of movements, you can get pain in the ball of your feet. So it's really an overuse, a lot of added pressure, okay? Walking hills, hill walking. Another example, if you're walking up hills, you'll tend to be pushing up on the ball of your foot as well, okay? If you're doing a lot of walking, a lot of inclines or running inclines as well, that will put pressure on the ball of the feet. So I tell everyone, you know, so if you watch your footwear, you know, wear good footwear. Avoid the high heels. Anything over an inch is not good for the ball of foot. Change your running style if you're a runner, if you're getting pains in the ball of the feet. And if you're none of those, if you find you're wearing normal shoes and you're still getting pains in the balls of the foot, you should get that checked out, okay? What's possibly quite happening there is that you could have hammer toes or dropped metatarsal heads, okay? So your toes would be, you'd see that, they're hammer toes, so the metatarsal heads are dropped, Okay, and that puts a lot of pressure on the metatarsals as well. And you see that generally, I see it anyway. Can't vouch for anybody else, but I see when I see toes like that, the person would generally a lot of time would have a high arch. Okay, so you'd see a lot of people with flat feet, but sometimes you'd see a person with a high arch, and then that can create an abnormality in the metatarsals where the toes, the metatarsals become dropped, the toes become kind of claw-like, and that puts a lot of stress on the joint around that area there as well, and you can get a lot of ball of foot pain from that. That's generally hereditary, you know, we're born with those, our parents had feet like that. So, and you'll see people as well with flat feet, they can get very common as well with fallen arches, flat feet. They will have a ball of foot pain as well. Not all of them, but they can present with it, okay? So what tends to happen there with the fallen arch, there's not enough support under the arch, so which is putting a stress on the tendons that run underneath, and also puts a stress on them, which in turn it will have an adverse effect on the whole mechanics of the foot. So you will see they can present with ball of foot pain as well. So for those type of people, I would always recommend you wear good footwear, good supportive shoe, good supportive runner, arch support, and a good custom-made orthotic is really, really beneficial for that. Okay, the generic ones are no good. Okay, you need one that is going to be built for you, designed for you, with the mechanics of your body, with your foot mechanics, your gait, everything taken into account. And when they're built correctly, okay, and they're put into your shoes and your runners, whatever the case may be, that can reduce a lot of the forces on the ball of the foot. And generally with the orthotic that we would build for that particular pain, we would put in what's called a metatarsal bar, which can support the metatarsal in that region, which in the leg. So that will take a lot of discomfort and a lot of pressure off of the region, which in turn can help with pain in the ball of the foot, okay? And also with any neurological symptoms you're having in the foot, like pins and needles or numbness, very common, Morton's neuroma. We can build little cushions there that can take the pressure off that as well, okay? Now, if it's a case you don't want to go down the orthotic route, you can go into the pharmacy and you can get devices called met bars. You'll see them there in pharmacies. Even if you try online there, you can go in, just type in, what would you type in? Just a ball of foot pain relievers, metatarsal bars. Try that, okay? And they're little cushions to go under the ball of the foot, and you just put them onto your toes, and that can give you some relief as well. But as I tell everyone, the pain is a symptom, all right? The pain is a symptom. You got to find what's causing the pain on the ball of the foot before you get the best results with it, okay? So treating the pain is no good. You can't treat the pain by doing physical therapy, acupuncture, laser therapy, shockwave therapy, loads of therapies, okay? And physiotherapy. And a lot of that is extremely good for getting rid of the pain. But if you don't get to the root cause of it, okay, if there's mechanical issues, be it from the lower back down or anywhere, but especially or from the foot up, you would need to address those areas, and then you will reduce the likelihood of any reoccurring pain in the ball of the foot. All right, so just to cut to the chase, avoid high heels, okay, avoid tight, ill-fitting shoes, avoid very flat shoes with no support, no arch support. Curtail your training. If you find that you're getting this pain when you're running, you got to look at the style of the way you're running. You're just running on the ball of your foot and not heel striking, so you're not creating a balance in the running style, as it were. So and your training. If you find that you're doing any training that's aggravating it, you got to look at your training and maybe reroute it or change the style, change how you're doing your training. But one thing you should not be doing if you're training and there's pain through it, that's not normal. Okay, so you got to get it addressed, otherwise it will get worse. You get bigger issues and more severe issues if you allow it to continue. Worst case scenario, there's a danger you could damage the nerves that pass through there, and that's not good either. Okay, so look guys, I hope that information helps. If you have any queries, please give me a call. I'm doing free consultations with everything that's going on. Pain doesn't go away just because the coronavirus is here. So if you want to reach out to me, if you have any queries, if you want me to try help you, please message me on Facebook through Messenger or through email or whatever suits you, and I will be more than happy to do a consultation and do up a program for you for your particular needs, and hopefully that will help you get through until we're all back in our clinics again and doing a bit of work. But there's lots of home care exercises that can be given that will help you with any discomfort or pain that you might experience over these next few weeks or months, whatever the case may be. Okay, so feel free, please don't be shy. I do not mind, I just want to give. Okay, so I've loads of time on my hands. If I'm not in here helping my patients, the missus is going to have me hoovering and doing stuff which to be quite honest I'm not great at, but I'm good at this, and I'd rather spend my time in here if I can help people. So lads, reach out, don't be afraid. Any queries, share this video. Anyone you know who's in trouble, feel free, tell them to call me and we can have a discussion, and hopefully I will be able to help them, and no fees whatsoever will be asked or nothing. Okay, so look guys, look after yourselves and take care of everyone, your loved ones especially. Keep up the social distancing. Please God, we'll get through this all in one piece and sane. And I will go now, and we'll talk to you all soon. Susan Cusick, how are you? I hope you are keeping well. Thanks for tuning in, hon. So look guys, I'm out of here. It is 7:30. I'll post another video tomorrow. If any of you have any ideas or any subjects or any issues that you might have that you would like me to talk about and give some tips on how to help it, just leave a comment in the section below and I will speak about it. So if you have any ideas what you'd like me to talk about, and that you have any issues that you need some tips on how to help it from a physical therapist point of view and not from Dr. Google, leave a comment below and I will be more than happy to help you. Okay guys, thanks very much for tuning in. Susan, you look after yourself and your mum, and I will talk to you all soon. God bless you all folks. Thanks, mind yourselves. Bye bye. Still here.